As people eligible to receive COVID vaccines line up, from healthcare workers to long-term caregivers to those over the age of 65, there's one group of people also providing critical care who don't yet qualify. Family caregivers of those living with Alzheimer's disease or dementia, and there are 85,000 people currently diagnosed with it right now in San Diego County. New at 10, Alzheimer's San Diego launched a campaign today to shine a light on this, calling on the governor and county officials to prioritize the unpaid family caregiver for vaccinations, regardless of age. I spoke with the president of the organization, who says vaccinating the caregiver protects those battling the disease in more ways than one.
Just imagine if I am caring for my mom at home and then I get COVID and end up in the hospital, who's caring for her during that time? So really, by vaccinating, the unpaid caregiver, you're protecting two people. And it really is important. So we're not looking to jump the line in any way, but looking to get protection for those who need it.
And what is the average age of the people that you serve in terms of the patients that you serve?
The people with dementia, it ranges. I would say the average is about 84. And so then the caregiver could be a spouse, it could be a child, it could be a grandchild. The caregiver ages are all over the board. And that's why just prioritizing by age isn't always the best way, in our opinion.
I'm dealing with my own personal issues and trying to look out for my mother, who suffers from Alzheimer's. And what are you hearing from the caregivers of how they're coping?
Caregivers are really exhausted because the opportunities to get a break are fewer and farther between than they were before. And it's a lot. 24/7 is a lot. And so we've even during this time started a counseling service where people can meet one-on-one with a licensed clinical social worker to get some extra support. But there's no opportunity to get a break like there used to be. And that's what's really tough.
We hear from healthcare workers just the level of exhaustion that they're experiencing, but it sounds like your family caregivers are right there with them.
Absolutely. Absolutely. There's just no chance for a break. And they're seeing their person decline because of all these other factors.
And the restrictions, because what are some of the things that help people who are suffering from Alzheimer's and dementia the most in terms of therapies in your experience?
Sure. Getting out, being involved, routine, social engagement, getting out and exercising, a lot of the things that can't be done safely right now. And so it makes it very difficult.
And if people do want to help get the word out that your family caregivers need to be prioritized for vaccinations, what can they do?
We ask them to reach out to their local county officials. Again, they could go to our website at alzsd.org. We have an advocacy page there, and there's guidance there on how to reach out, as well as it can help you find out who your official is, what area of the county you're in as far as who your supervisor is.
And again, that's alzsd.org. If you want to advocate for family caregiver vaccinations or need help yourself, if you or someone you know is living with Alzheimer's or dementia. Eugenia Welch also says it's important to keep in mind the isolation and depression for anyone that can happen with COVID. And right now, 1 in 4 people with dementia live alone. So a lot of people could really use the support.